Welcome to the UN's 2021 Science, Technology, and Innovation Forum, and thank you all for joining us for the panel on maternal, newborn, and child health innovations. My name is Tina Assi. I'm the Director of Global Health Innovation at Grand Challenges Canada. For the past 10 years, we've been investing in innovations that advance women and children's health across a multitude of domains, and so it's my great pleasure to be moderating this panel. As everyone on this call knows, the Sustainable Development Goals are bold and ambitious. Achieving them means the possibility of establishing peace, generating prosperity, and nurturing a healthy planet. Bold and ambitious goals require bold and ambitious solutions that enable us to achieve those outcomes in ways that are better, faster, and/or cheaper, and ultimately meet the commitments we've made through the SDGs. When it comes to maternal, newborn, and child health, progress over the last decade has been made, but that progress is uneven across regions and countries, and much is still needed to avoid preventable morbidity and mortality among women and children. Before we begin today's panel, a few housekeeping notes. We welcome you to interact with us by posting relevant questions for our panelists in the Q&A box to the right. I will ask our panelists a subset of these questions during the Q&A portion of the panel. When posting your question, you'll be prompted to add your name, also add your organization if you'd like. You can also like and respond to questions or comments others post. Please be respectful and note that any questions that are not appropriate, not directly relevant to the dialogue, and/or not in line with the UN Charter will be deleted. And so it is my distinct pleasure and privilege to be moderating today's panel. With me today are the five winners who are leading innovation in maternal, newborn, and child health. We have Federico Nakarato, Global Project Lead with CODA, Shivi Kapil, Founder and CEO of Empathy Design Labs, Innocent Menyo, Co-Founder of Emscan, Ambrose Katungi, Africa Regional Director with We Care Solar, and Ratul Narain, Managing Director of Bamboo Health. We have an hour together today, an ambitious set of questions, so let's dive right in. To start us off, I'm going to invite each of the panelists to tell us a little bit about their innovation, what the key challenges in maternal, newborn, and child health that their innovation is addressing, and how the innovation addresses these challenges and contributes to changing the MNCH landscape. So let's start with Federico.
Thanks, Tina. What a pleasure and an honor to open up this panel. So about CODA. CODA is a digital transformation system created by WFP that allows us to enhance the way we offer and we run malnutrition treatment operations in the field. Thanks to our combination of hardware and software technology, we can now leverage the power of data digital collection and also big data analytics. In fact, thanks to CODA, we can now allow field workers to move away from using paper-based ration cards, as the one you can see in the background of this picture, now using our digital system that really helps them to enhance case management at field level, and also giving the opportunity to access real-time data and analytics that are related to the health of our beneficiaries, the people we serve, the people in need, and also in relation to the outcomes of our assistance operations. Of course, there are many other benefits and added values outcoming from CODA, and I will be happy to answer more detailed questions in the Q&A session later on today. Thank you so much.
Great, thank you, Federico. Shivi, can you tell us a little bit about Empathy Design Labs?
Hello, everyone. This is such an amazing opportunity to be able to connect to all of you and to share the innovation we have been working on. My name is Shivi. I'm founder and CEO of Empathy Design Labs. We are a health tech startup based out of Bangalore, India. Back in 2015, I was a fellow for Government of India, where during my field research, I identified a lot of maternal health challenges. I heard about hundreds of pregnant mothers' stories of losing their pregnancies, having stillbirths, Also caregivers who were mentioning that patient did not reach on time and how they couldn't help the patient because they did not have certain technologies or solutions. This made me understand the maternal loads and maternal issues like late referral, the problems of poor antenatal health checkups and poor access to the health. And that's where the another part of it made me understand that, you know, not all mothers could have the understanding of pregnancy more than just a feeling. But what if we can design a solution which can make them understand and you know, so that they are able to take decision on time and to the reach, so that they can reach to the caregiver on time. That's where we developed Kriya. Kriya is a wearable IoT patch which tracks the pregnancy during the pregnancy period. It tracks the health of mother and the baby both. We also have an app which tracks the mental health, stress, and, you know, the anxiety of mother on a weekly routine basis. So yeah, that's what we are trying to do. Thank you so much.
Thanks, Shivi. Moving on to Emscan. Innocent, can we turn to you?
Thank you so much, Tina. Very happy to be a panelist here. I'll tell you a bit about Emscan and what we do. So Emscan, we are developers of portable ultrasound devices. The devices work on laptops, tablets, and mobile phones. And a little bit about the background of Emscan is many years back when I was a medical student and posted in rural Uganda, I saw many mothers die of complications related to pregnancy. Some of these included the placenta being in the wall of the cervix, you know, a cord around the baby's neck, and so many other complications. But the midwives attributed this to the fact that most health facilities could not afford traditional ultrasound machines because these machines are very expensive, they use a lot of power, and they're also very sophisticated to use. So with this background, we came up and innovated to come up with something that, you know, can fit in a low resource setting, something that can be used on an everyday tablet, laptop, and something that can actually be used by a midwife. So what exactly we do is with our mobile scanners, we are able to detect these risk factors, even in the low resource settings. I refer these mothers on time and we follow up and make sure that they are actually intervened. To date, we've scanned over 1,000 mothers and looking more to share on our experience with you, the audience. Thank you so much.
Thank you, Innocent. Ratul, over to you.
Hi, I'm Ratul. I'm the founder of Bamboo Health based in Bangalore, and we make medical products that help newborns survive in low resource parts of the world. So there are about 20 million babies born every year in the world that are born low weight. And two of the top causes why these babies die or face injury are hypothermia and infection. And our flagship product that our team developed was this tiny bracelet that you can see in the background there. It's called the Temp Watch, and it catches hypothermia and infection early in low weight newborns, thereby preventing injury or death. We're fortunate to, it's essentially monitors their temperature day and night, all the way in the hospital and in the home where a lot of these complications happen. We're fortunate to have support from Grand Challenges Canada and the Saving Lives at Birth partners that helped us develop the R&D, validate, and launch these products in difficult markets. And we are fortunate now to have reached about 35,000 babies, having implemented with partners like you see here in the back, like UNICEF. I'm so excited to be here. Thank you, Tina.
Thanks, Ratul. Great to have you here. And finally, last but not least, Ambrose, tell us about We Care Solar.
Thank you, Tina, for the wonderful remarks and introduction. My name is Dr. Ambrose Katunji Mwezi, and I'm the Africa Regional Director for We Care Solar. Around the world, hundreds of thousands of health facilities are in darkness each night, and they have deliveries. Babies can't wait, they have to be born. You can imagine those circumstances, the likelihood of death for the mother of the newborn is very high. We Care Solar is saving lives at childbirth using an innovation called the We Care Solar Suitcase. You can see in the background. This is a robust, compact solar electric system that basically is designed for healthcare and in a suitcase. The suitcase is comprised of 4 medical lights. These are high efficiency lights that support deliveries and cesarean sections. It also has a fetal heart rate monitor that allows midwives to monitor labor. The Suitcase as well has 2 headlamps. These allow midwives to do procedures when light is not very adequate. We also added an infrared thermometer in the context of COVID-19, which allows screening of clients that come to health facilities. But also, this Suitcase allows charging of mobile phones and other portable devices, which are critical in communication and proper patient referral. Now, all those components I've mentioned make the Suitcase very unique in the sense that it is designed to give midwives the power to save lives. I'm happy to mention this because today is International Midwives Day. And so giving the midwives the power to save lives becomes very, very important. In the last 10 years, WeCare Solar has installed over 6,000 Suitcases in several health facilities, serving over 7 million mothers and newborns. And WeCare Solar has continued to implement national level Light Every Birth initiatives, working with governments and ministries to ensure that maternal and newborn mortality is averted. Now, specifically for me, as a physician for close to a decade, I have worked in the most difficult communities and situations. I have seen what it means to deliver care to a mother, to a newborn in near darkness, in the middle of a procedure, and there is no power. And I have seen the transformation that occurs when the facility goes from darkness to light. I thank you for inviting WeCare Solar to be part of this, and I hope we go ahead to serve millions of mothers out there. Thank you so much.
Thank you, Ambrose. So to the audience, you've now seen, you've now heard a little bit more about these 5 innovations, and hopefully you have a sense as to why they were selected as the finalists for the UNSTI forum this year. They are robust innovations. They're thoughtfully designed. Each feature, each functionality has been developed following hours upon hours, years of field research with end users, beneficiaries. But in a pandemic, all of that work stops in a sense, or has to change. These leaders are working in, as you've just heard from the panel, very challenging circumstances and very challenging settings, made even more challenging in pandemic circumstances. And so now I'd like to switch gears and focus a little bit on how the pandemic has affected, in either positive or negative ways, the innovations that our panelists are moving forward. And I'm going to follow the order that we started in. So Federico, can you tell us what were some of the unexpected sort of positive or negative challenges that you all faced with CODA?
Thanks, Tina. Indeed, this pandemic has been quite an experience. Maybe just to start with, it's important to understand that CODA, it's a bit different from other commercial products because it's really a service that is fully integrated in our life-saving operations. So it's not just something you can plug off from one day to another. So we really had to readapt very, very quickly and fast to these new challenges that the pandemic was bringing up. And maybe also probably the fact that, WFP is used to be working in emergencies makes us really resilient. So I think we did a great job. The whole team did a really great job in facing these challenges outcoming from the pandemic. I would say that we had both opportunities and at the same time, of course, major challenges. But maybe I will start from the opportunities because I think it's a great learning experience. So in terms of opportunities, I think that the most interesting outcome has been the fact that we managed to, or we were forced rather, to really speed up already our plan that was more in the mid-long term to create an e-learning platform to support few colleagues to understand how to adopt CODA and to roll it out in the field. So actually in December 2020, a bit confused on the time now because of I mean, this year and a half has been basically a stop in life almost. So in December 2020, we rolled out a new implementation of CODA in a very difficult context also, because we rolled out in Afghanistan. And this, we managed to do this completely virtually. So we did a fully virtual implementation, providing support to our field workers and our colleagues directly in Afghanistan. And this taught us that we can, be much more efficient, cost effective, and also be at the same time in many more places at the same time if you want, right? So usually we would need a few weeks or even 1 month to support a new country to adopt CODA. Now we can do this simultaneously in more country offices if we want, because of the power of this virtual and the e-learning platform and our new processes. And so this is, I think, the main learning and the positive outcome, if we can say. In terms of challenges, I really want to emphasize the fact that, very often we tend to forget when we see products and projects out there that there are real people behind these projects. And I think that the major challenges I have been facing, at least as a manager, was really to ensure that, the colleagues and the whole CODA team could operate in an efficient way, but at the same time in a healthy way. Especially during the first months and weeks of the pandemic, we didn't know if this was going to last 3 weeks, 3 months or 6 months. Now we are 1.5 years into this pandemic, and we are learning that this is a marathon, not just a sprint. So in reality, my major concern has been to ensure that, if I can say, the mental health of the colleagues could, or rather the colleagues could maintain a good and proper mental health, in the sense of, I saw many of my teammates really deep diving into work and just working crazy hours, to the point that I had to really be hard on them sometimes and tell them, I don't want to see you online anymore. Like, past this hour, I want to see your status offline, because otherwise you will just burn out. And this will not be beneficial to yourself and also to the project overall. So just in terms of how I try to do this in the most effective way, I really try to switch and try to have very friendly also relationship with all my colleagues that we already have, but even more so, really putting very often the hat of a friend, and having one-to-one check-ins on them to make sure that they were doing fine, and just to listen to their personal problems sometimes and challenges, because we have been all very far away from our beloved and our families. So it has been tough. So I hope these can be experiences that people can benefit from. Thanks so much.
Federico, I think it probably resonates with other panelists, myself definitely, and audience members, that this is a marathon, not a sprint. It's a good reminder. I'd like to take this moment to just remind the audience that you can post comments, questions in the panel to the right. Please do so. We will get to those after the next question. Shivi, can you tell us experience from Empathy Design Labs?
I think I can totally relate to what Federico has shared. In last year, around March, April 2020, what had happened, we started getting a lot of inquiries from pregnant parents, especially fathers, who were reaching out to us because they were anxious. They were clueless that, because of the infection, because of the loaded hospitals, they were not able to go for their routine health checkups. And because of the poor antenatal health checkups, mothers were anxious because they might turn, and even the low risk pregnancy can turn into a high risk pregnancy because of no checkup. This can also, this has kind of opened more opportunities for us, where we can directly access parents to provide our solutions wherever they are. And I've been, right from my entrepreneurship journey, I've been a vocalist to bring solutions to people wherever they are, rather than, calling them to the innovations. And this kind of totally validated our case that, how we can provide this solution. This has totally boosted our confidence in that way, in our use case. But it has also been challenging because we work with the hardware as well, and our teams have been working remotely all this time. COVID situation has not been very great in India. We hear every other day about the team members having infections, having COVID situation in their family, in their family or extended family members. So this has been definitely tough. Definitely not normal. But what we have done, we have created a routine of taking breaks to restore our mental health, because it is very, very important. The physical distance has increased, but our emotional distance has actually totally, removed. We are more bonded emotionally. We are sharing each other's strength and even vulnerability even more. I think that has been definitely a different experience altogether for the entire team. So this has a positive and negative side. Production has been definitely slow because of factories have been less functional. But yes, but still, I think the team is very, very hopeful in the coming time forward, and we hope that we'll be able to do better from today. And we are definitely looking forward to the future with bigger hope. Thank you, Tina.
Thank you, Shivi. Innocent, can you tell us a little bit about how COVID-19 has positively, negatively both impacted Emscan?
Thank you so much, Tina. Of course, like the earlier panelists have talked about, the pandemic posed so much challenges. And for Emscan in particular, being both a software and hardware, innovators, the supply chains were very disrupted. Some of the materials, all the raw materials that we get from China, we couldn't get. And it affected so much in terms of completing the units that we usually develop locally, and also the embedded systems that we solder from China. But regardless, as things have kept on easing and the borders opening up, it has resumed very well for us, and we're able to do the developments. We are no longer finding that a challenge anymore. But also on the more positives, we were able to come up with a home-based ultrasound service model. With this model, we do home-to-home ultrasound services. This is in reverse to what we were doing before. We were doing up-country visits, we were doing pilots, we were doing medical camps. But because of COVID, we couldn't do these gatherings. So we had to innovate and again come up with a model that fits perfect for the people who are held in homes because of curfew, because of transport challenges. So right now at Emscan, we are developing, and we've developed and trying to grow a home-based ultrasound service model. With this model, a mother is able to order for an ultrasound scan online through our booking platform. We go do the ultrasound scan and then refer them to the nearest clinic. And sometimes we've actually had to evacuate the mothers because you go to a home and find the mother is in a dire state, and they actually need to be evacuated. So this has all been opportunity for us to actualize our vision of reaching out to mothers who need most our services of ultrasound scan services. And we are very happy to come to their service.
Thanks, Innocent. So it sounds like Empathy Design Labs, Emscan has pivoted, has enhanced services in light of the new challenges that have been presented with the pandemic. Curious to know, Ratul, how that resonates with Bempu's experience over the last year with the pandemic, opportunities, challenges, positive impacts.
Yeah, thanks, Tina. I think I resonate in that challenges can pose opportunities. Our business really has two components that were hit. One was the sales, and the second was the R&D. Prior to COVID, our strategy and a lot of our sales came from in-person selling. We'd go to conferences, we'd go meet doctors, we'd go meet governments and sell to them. And during COVID, that all halted. And what that forced us to do then was come up with a virtual sales model and focus on customers we could reach virtually. We started learning how to do demos virtually. All our team got trained on email, CRMs, all these kinds of models. And now we are essentially selling virtually which is even more efficient and more profitable for us. And we've been fortunate now to open more international accounts, which are more receptive to virtual selling in Mongolia, Peru, Pakistan, and several other countries. The second area that I mentioned was R&D. We had to figure out a way to still do our R&D, launch products all virtually. We still held to our deadlines. So we were able to launch 2 products during COVID and then develop a third product, which was a really innovative, comfortable mask for children. And then a lot of what we could do virtually was around our quality. So we got CE certification, ISO certification, and then our clinical team also really pushed publications. So we made the most of what we could to set us up for success for when COVID goes away, so that we're ready with more products to sell and we're ready with quality and clinical certifications to get going.
Thanks, Ratul. And Ambrose, how about with We Care Solar? Sorry.
Thank you, Tina. Can you hear me?
Yeah.
Yeah, thank you, Tina, for that comment. And I'm happy that people have adapted in different ways. But for We Care Solar specifically, during the COVID-19 pandemic, the suitcases and the work became more pronounced as the need for our systems became more important than we ever thought. You know, we all know. Can you hear me? Yes. So we all know that. Thank you. So we all know the use of light in just doing anything around your homes, around where. And so in service delivery, specifically for health facilities, the need for light and electricity is very important. Imagine being a health worker and having to find out who is sick and who is not in darkness. That becomes very, very challenging. So in the countries that we operate in, we worked with governments and they told us that light is part of essential services. So we're given a go-ahead to do installations in several countries, even amidst lockdowns. And that was able to allow us to continue doing implementation. I can say that the solar suitcase and its devices are very critical in patient screening, the thermometer, in supporting isolation and treatment centers, but as well for infection control and prevention. And so those were able to continue supporting it. But what I would like to emphasize, I think in light of COVID-19, was the program level adaptation. We had to look through our programs and see how do we implement better. And so the first thing we did was to put up guidelines to support the staff and our contractors to be able to do a good job. And these were to keep them safe so that they don't go out there to do installations and end up catching COVID-19. So the second thing was to come up with a hybrid model that allows remote training of installers. We're able to do training for installers in Sierra Leone and allow them to go on with installations. The third thing we did was to look at how the suitcase can be able to support COVID-19 specifically. And so we added an infrared thermometer to our devices, and as well as face masks. And these were to support midwives and other health workers to continue effective service delivery. And so the last thing that we did was basically to look at how do we continue to engage in our partnerships. And so that allowed us to continue doing virtual meetings with all the stakeholders at government level, at regional level, so that we are able to continue building on the partnerships. Now, these critical things all came together. I can say in 2020, we installed over 1,000 systems. And that is higher than even 2019. So COVID-19 allowed us to be able to expand more and more. But what I would also want to emphasize is that COVID-19, or in form of any pandemic, innovations are challenged. It's also a time for us to be able to think better, program better, and be able to implement better. So I thank you very much for listening to me.
Thank Thank you, Ambrose. So as you can tell, there were a number of challenges that the pandemic presented, but the challenges for each of these innovations seems to have also presented opportunities to add more thoughtfully designed features, elements, approaches to these innovations to make them more responsive, to make them more useful to the end users, to the beneficiaries. And a lot of work has gone into over the past year preparing for what comes next. So to build off of what Ratul was saying, how do you position yourself for success once the pandemic is over, because it will end. And so I'd like to shift gears in our final question before we turn to Q&A from the audience. And just a reminder for those of you who have joined late, you can post comments and questions in the panel to the right. We invite you to do so. There's some great questions already that I'm excited to ask. But before we get to those, one final question to the panel. Looking beyond the pandemic, what's next? What's next for your work? What's your top priority in the next year beyond the pandemic? And what resources and supports do you need to set yourself up for success? Let's start with Federico.
Thanks, Tina. So looking forward for CODA, I think that we have three major areas in which we want to focus. First one being continue to drive impact at scale. So ensure that CODA can continue to support field colleagues, not only in the countries that are already adopting CODA. So for sure, we want to continue to support the countries that already adopted CODA to grow their operations further. But then at the same time, continue to offer the service to other WFP country office and WFP operations worldwide. A second point will be to improve our data analytics in general by focusing and calculating sphere indicators. There are some specific indicators needed for malnutrition treatment programs, and also integrating with systems such as DHIS2 and other health management information systems that government use. So that we can also ensure that we can add value for host governments. Further, last point, I think that it will be related to the need to improve technological stack. Technology always needs to be improved. There is never, it's a never-ending story, right? We all know that. Specifically, what we will want to do is to now focus on finding a way to integrate even further more with external systems, so external from WFP corporate systems, so that we can continue to contribute generally to global digital goods. What do we need to do all of this? Of course, this requires access to resources, both in terms of funding, so financial resources, and also in terms of partnerships, mainly technological partnerships. So I know that we have a pretty large audience today, and I'll be happy to discuss any opportunity moving forward with anybody. Thanks so much.
Thanks, Federico. And for the audience, we will be showing the slide that has all of the panelists' contact information at the end of this. And so I do encourage you all to continue engaging post this panel. Shivdi, over to you. What's next for Empathy Design Labs?
So Tina, we have been working for a pilot actually right before the pandemic, and now because the situation has been little different, now we have been working remotely to work like what we can do now and probably for next 2 years. So we are trying to deploy Kriya in 5 Indian states first in the next 2 years, and we are estimating to reach about 50,000 pregnant mothers in this time. We are trying to work with the state governments because we need to work with their public health record system, how we can implement their technologies with our technology, and if there's any work needs to be done there. So that's something we are working on now. Looking at the numbers and looking at the type of challenge we have, we definitely need support from donors, from philanthropies who are passionate about maternal child care and who are focused towards developing countries like India. We are also looking at international development agencies who can actually help us in implementing the solution in not just in India, and in other developing countries who are in need. I've been reading about, last 2 days, it has been such a traumatic instance where I've been reading about the mothers, pregnant women dying in Brazil to COVID, and a number has been really, really high, and I can totally relate to the situation here we have in India. So this is, I'm trying to, call out all the, I'm trying to invite all the partners who can actually help us financially through the implementation way. And I'm sure we'll be sharing our, you'll be sharing our email IDs, and I really hope that everybody reach out, and this is a time for collaboration. This is a time for partnerships for all of us. Thank you so much, team.
Thank you, Shivi. Innocent, what's next for Emscan?
Thank you so much, Tina. Of course, there is so much loading up for Emscan, but very specific. We are building the HBUS model to be something that's very, very big, to just go beyond the ultrasound scan. So we want the home ultrasound-based service model to be an antenatal full package. So we come to your home, we do an assessment with a midwife, we do a scan, then we advise you thereof of what exactly to do in terms of the complication we've detected. So it's a model that's growing, and there's a lot of interest from the pilot we are doing right now with JICA Uganda. So many mothers are reaching out, and it's a model that's very profitable for Emscan to think about. Of course, we are also generating other avenues to generate money, because with COVID, some of the challenges I could have missed talking about is the funding gap. There was a little bit of, the downside of funding. So we are now also starting to manufacture ultrasound gel, which is a very key component in offering ultrasound services, which is also another profitable avenue for Emscan, and to see that we actually proceed with a lot of sustainability in mind. We look out for financing investments, partnerships in form of manufacturers. There could be partners into maternal and child health that are particularly interested in the home-based ultrasound service model. This model is, like I said, it's going to be more of an ambulance model. We are able to do all the antenatal, and where necessary, we are able to evacuate the mother. The HBUS model also addresses the issue of affordability. We know that the COVID has come with so many challenges in terms of financing. People are stranded home, some have lost jobs. So with the HBUS model, again, it comes with subsidies to the mothers who order for these scans. And in the end, we are able to achieve impact at a very affordable cost for the mothers. Thank you, Tina.
Thank you, Innocent. So I love how specific these asks are. This is how we advance really ambitious objectives. So I hope everyone on the panel is taking notes. Ratul, over to you. What's next for Bempu Health?
Yeah, so Tina, COVID has set back a lot of the progress that has been made for newborn health. And for us, this is our time to help catch up on that progress. Our Temp Watch bracelet can be implemented really quickly and help prevent death from neonatal hypothermia in the home setting where a lot of these babies are, because of avoiding the hospitals. So we're eager to get going, and I would like to ask the audience for maybe 2 areas of help to help us reach more babies. The first is that we're looking for newborn programs around the world that can use not only our Temp Watch but our other products to help reduce neonatal mortality. The second area we're looking for help is for strategic partners who work in the pediatric space, pediatric manufacturers, distributors of neonatal equipment that can help us reach more babies in other parts of the world. Thanks.
Terrific. And last but not least, Ambrose, We Care Solar, what's next? What's on the horizon?
Thank you, Tina. Being the last, I have to enjoy this, but thank you very much. Like I mentioned, so We Care Solar is basically founded on 3 fundamental beliefs in the current Light Every Birth initiative that we are implementing. And one is that every woman has a right to safe childbirth. The second thing is that every health facility is entitled to reliable electricity. And thirdly is that solar energy will offer an immediate and sustainable solution this global health change. Now, the fact is that as the COVID-19 has impacted differently on different organizations, as We Care Solar, we are implementing beyond late every birth that we're currently doing in Zimbabwe, Uganda, Sierra Leone, and Liberia. And we're looking out for additional countries who can be able to do more work and reach more health facilities, more mothers, more newborns. So we are seeking for partnerships. One, support funding for manufacturing, for shipment, for implementation. Two, would look out for solar partners that can support in installations. And then finally, we need health implementing partners to work with at field level implementation. And so this should be able to allow us reach our target of over 4,000 health facilities in the next 3 years. So I look forward to any form of coalitions, funding, support in all ways. We want to be able to work with our governments, through line ministries, work with UN agencies, international NGOs, civil society organizations, to be able to avert maternal and newborn mortality. We believe that no woman should die as she's giving a life. I thank you very much.
Thank you, Ambrose. Great. Well, thank you to the panelists for getting through those questions. We now have about 8 to 10 minutes max for audience Q&A, and there's some pretty big questions here. So we're going to try to go through them quickly, and I'm going to try to get at least 2 of the panelists to respond to each of these questions just to manage time. And so let's start with this question from the audience member. COVID has disrupted health systems. How do your innovations support the rebuilding of the health system and catch up on the progress we had pre-COVID? Who on the panel would like to tackle that question?
I think I would go first on that. Of course, we are challenging the status quo of access to healthcare. I would say, for example, for Emscan, our devices are very portable. They offer point of care. And we know that with point of care, we are reducing on the movement of patients. And therefore, we are reducing on the spread of the pandemic or the virus in the hospitals. The initial experience was that if someone needs a scan, they have to send them from, say, room 1 to the radiology department to do an ultrasound scan. But hey, Emscan, we are saying that we can actually now do an ultrasound scan by the bedside. We can do the scan from wherever the patient is. And this is, reshaping healthcare without disrupting the desire of quality results. So I think it's a contribution to offering quality healthcare, but at the same time also addressing the urgent needs of how do we spread the pandemic, in particular COVID. Thank you so much.
Thanks, Innocent. Does anybody else on the panel want to tackle that question?
Tina, I want to add something to it. So I personally feel health systems are built over time, and of course, it takes a pandemic to really actually shaken it out and see what's working and what's not working. So how I see this pandemic, that it has also given us opportunities to contribute from all of our sides. There is a bit which we all can do. So similarly, like what we are trying to do at Empathy Design, we have been talking even before pandemic. We have been talking about mental health of pregnant mother. Which is definitely I haven't seen anybody talking about pregnant women, because it's just taken that pregnancy is like a concerned time where mother is in a different phase. But now people are actually taking mental health more seriously. People are talking about it. It has become a need where people are finding solutions for something like this. So I definitely see that this is a bigger chance for all of us innovators and entrepreneurs to bring out solutions which can make more meaningful solutions for people. Of course, not just for physical well-being, but mental health as well. And that's what we are also trying to do at Empathy Design Labs. And I hear from all the panelists as well how incredibly wonderful they are trying to contribute to the same.
For sure. Thanks, Shivi. The next question we have on the list from the audience is, I would love to hear about your most important partnerships when implementing your innovation. What advice do you have to form these partnerships? Panelists.
Maybe I can go. I mean, I think that in general, the most important thing, in my opinion, when driving change and innovation, especially at field level, is to ensure that people feel part of this change. So, especially in terms of partnerships, but more in general, also adoption of innovation systems. I think that what we try at Coda to focus on in general, it's really to make sure that we try to get all the people, all the stakeholders involved from day zero, and ensure that they feel part of this change. So it's not something that is imposed, but it's something that we build together, and they feel part not only of the problem that we're trying to solve, but especially they're part of the design of the solution. This will be my take on this. Thanks.
Federico, and I think Ambrose, you wanted to share a bit on that question as well.
Thank you very much for the question. So partnerships are very critical in innovation. And for me, what is important is to be able to partner with somebody or stakeholders who think alike. You're in the same direction of implementation. You have the same beneficiaries. You want to be able to achieve those goals. But for WeCare Solar, what has been, I think, important for us is to understand that we have partners who are the end users of our systems. So to be able to receive feedback on the innovation and improve the innovation to be able to meet the needs of the users. It's very critical to be able to maintain and sustain the innovation to offer the right service.
Thank you, Ambrose. The next question from the audience is, all these products and services are amazing, but they also seem expensive. Can you all talk about the price of your innovation and how it affects the user?
Yeah, sure. I can comment on that. Innovations, I think, can be expensive at the beginning because you launch in small quantities. Your supply chains aren't there. You have to build awareness about the innovation and talk to a lot of doctors and do a lot of traveling. And so, interestingly for us, during COVID, we switched our model completely to virtual, which was less cost. We refocused our R&D team to work on cost engineering. And that all enabled us to really kind of bring down our costs and make this more accessible. When we first launched, I'm a little embarrassed to say this, but when we first launched, we used to sell this bracelet for $29 per bracelet. And now we've re-engineered it. We also figured out a way to buy back the bracelets. And so the effective cost, if you buy in volumes, would come down to about $5 per bracelet. I still have a vision to get it down to $1 per bracelet, but our cost per live saved at that cost is still, maybe around $200 to $500 per live saved, which I think is still pretty good for an innovation. So in that way, COVID was an interesting experience to help us bring down our cost and set us up to reach more babies.
On top of that, I think when you look at a traditional ultrasound machine, it costs about $20,000 US, and Emscan goes for 10 times cheaper than that, at $2,000 US. But to be realistic, in sub-Saharan Africa, the $2,000 is still much when we've been able to market our devices to different facilities. But it has also provided a platform for us to understand models that work best in the markets where we are. So at Emscan, we've come up with models like, the hire purchase model, where a facility is able to pay up in installments and then they own the device, more of a lease to own model. We've come up with cost sharing models, and also now with a home-based ultrasound service model where the mother simply pays for a scan with our team of sonographers. We go scan them, and we don't rather sell the device, but Emscan as a service. So I think, again, it's about piloting and understanding the market in which you're operating to be able to curtail the pricing to that market. Yeah, but that's a good observation.
Thanks, Innocent. Great responses there. We only have a few more minutes, so I'm going to skip to the next question. It's very provocative. How do you balance scaling your impact with scaling your business?
I think, sorry.
Go ahead, Innocent, and then we'll switch to Ratul.
Yeah, I think you know, most cases for us scientists, we always focus on the laboratory bit of our ideas and forget the entrepreneurship bit. But as time goes on, we also get to understand entrepreneurship, that it's not just about building very amazing products, but also building something, you know, that you can scale. And when we talk of scale, we also talk of the pricing. So as much as we've built very impactful innovations, the issue of pricing has also come in very crucial for us to understand. And that's where we are doing different pilots to understand the market and basically the product market fit and what prices benefit all the markets that can be able to afford. And also, of course, understanding, you know, how much you can scale and what markets can you scale into, I think has been very, very important for us at Emscan. We've already mapped out the places where our device has piqued interest, and we are following up with these key interests. And they're also guiding on coming up with a price that fits perfect for them so that we don't feel the pinch of scaling. But I would also say that to scaling, of course, there have to be certain incentives that might not be realized from the different stakeholders. So some capital is always needed to do the scaling. So I think different partners in the audience should note that in form of investment, in form of you know, financing to fuel operations and things like that. So it's very, very important for the partners and the funders on the audience to note that. And thank you so much, Tina.
Thanks, Innocent. Ratul, any thoughts on that question? You were about to say something.
Yeah, you know, I think sometimes it can be perceived that business and impact are maybe at odds at each other, but I don't think that's necessarily the case. In fact, I think even when the pandemic hit and operations slowed down for a lot of people, it maybe made people realize how important it is to have a sustainable business that can withstand challenges like this. For us, we're really fortunate. We have a dashboard every week that shows how many products we sold. And that translates to revenue, which is our business. And that also translates to number of babies helped or reached. So for us, I think it's not really a balancing act. It's pushing forward so that they both grow simultaneously.
Terrific. Thank you for those insights. In our last couple of minutes, I want to ask the panelists for final closing thoughts, inspirations from today's discussions. And I'm going to start with Federico. Over to you. Last thoughts.
Thanks, Tina. Well, I mean, you know, today it's been great to join this panel, and I really see that all of us in this panel and many more that are not part of this forum today are really embracing innovation to make a change. And so I think and I really believe that innovation in general can really help us moving forward to support the right people at the right time and really leaving no one behind. Thank you so much. It's been a pleasure to be here.
Thank you. Shivi, final thoughts?
Yeah, I think Tina, in today's session, how I see it, like, you know, it has opened more doors than it has shut. It's a time for more partnerships, not just with healthcare providers, but also with fellow entrepreneurs like us. I think I see this current challenging time as a time where, you know, we all can collaborate rather than doing it all alone. And, you know, and then only we can make more meaningful solutions, not just for our own country, but definitely for everyone who's suffering with the same problem. So yeah, I'm open to discuss for those partnerships with everyone out there.
Thank you, Shivi. Innocent.
Thank you so much. It's been amazing to share, you know, what you're doing at Emscan. And to end, I would say that at Emscan, we are democratizing access to ultrasound, especially for the pregnant women. For us at Emscan, we believe that no mother should die in the process of giving birth. Emscan, save a mother, save a life.
Thanks, Innocent. Ratul?
I think my final thought would be that saving babies, saving moms, these are really big problems. They require big innovation. And as the pandemic showed us, they require big levels of persistence because they're worth solving.
You are right about that. And Ambrose.
Thank you very much, and thank you, everyone. The challenge of renewable energy for healthcare is for all of us. For everyone, for every innovator, the challenge is for all of us. And so the only solution is through sustained partnerships, continued trust, and fighting sustain these interventions. So for us at WeCare Solar, we continue to work against all odds to be able to reach that last mile health facility, to reach that last mile mother health worker, to make the environment of the midwife more comfortable and save the life of that mother and newborn. I thank you very much.
Thank you all. You've been a terrific panel. You've been a terrific audience. Thank you for joining us today. I think the key theme is with challenge comes opportunity. This is the final session of the UNSTI Forum. We hope you found it informative, useful, interesting. Once again, please take note of email addresses, contact information here if you'd like to follow up with any of our panelists after this session. Apologies, we did not get to some specific questions about specific innovations. Do reach out to each of the panelists, and thank you once again. This concludes the session. Bye for now.